Patient Benefit Foundation is just an incredible organization that provides quality medical care for those who are uninsured or underinsured. And it's so important to have events like this to raise awareness about everything that this organization does and the difference that it has made and will continue to make in so many people's lives.
The benefit for the underserved population is tremendous. Not only do we struggle with need for better insurance, but to actually have the opportunity to get vital surgery that's needed in the population is a must, and that's why this foundation is one of the best foundations that I know of that serves that underprivileged population.
Allow me to take myself back to those days when my mother was the reason for this foundation to be coming into existence. I was an ordinary physician coming from Pakistan, had the hardship, financial hardship, family hardship. I kept my resilience going and I did not give up. And to date, we pay for people's deductibles, even if they have insurance. Most of the insurance, many procedures, elective, they don't cover. We have done knee surgeries, we have done mastectomies, like I earlier mentioned, and we help those patients. There are heart-touching stories that we have, but the night is short and the evening is pleasant. So my request to you, all of you, is please find somebody or talk to somebody, initiate a conversation that we finally know an organization that claims $0 out of your pocket.
Dr. Chaudhry actually approached us at Shriners Hospitals for Children in Houston when I was the Director of Development there. Because he saw our mission as being very compatible with what his mission is at the Patient Benefit Foundation, which is that of providing surgery to those who need it but cannot afford it. And I can tell you that the Patient Benefit Foundation is a very unique concept. I don't know of any other philanthropic organization that does exactly what the Patient Benefit Foundation does. And that is, it does not provide direct service. It supports people who need services, specifically surgical services. And it's worth clarifying that what we really do is support people who need what we call elective service. Well, what that really means is patients who need services that can be scheduled. Someone who comes into Ben Taub in trauma, they're going to get taken care of regardless of their payment situation. However, the person who needs something that needs to be scheduled further down the line, they can get it, but they're going to wait. So there is a system for that in the United States. It's just not a good system. We're a very unique country in the world in that we do not provide universal health care. And as a result, there's a huge percentage of our population who either doesn't have health insurance or might have it, but they can't afford co-pays and deductibles and those kinds of things. And that situation is going to become much worse in the next 60 days as the subsidies for people who buy their insurance through the government exchanges, those subsidies go away. Their insurance premiums are going to go up to the point where they can't afford them anymore. So I think we're going to see more and more people who need what the Patient Benefit Foundation provides. And that is that kind of financial support to get surgical services that are necessary but not necessarily emergent. I think that is something that's very unique and worthy of support. And personally, that's one of the reasons why I agreed to come help Dr. Chaudhry, not only with his business, but also and serve as a member of the board. So it is a very amazing organization. I've never seen one like it. I don't know of any other in the country, and I have colleagues all over the United States, and nobody has ever heard of an organization that does what the Patient Benefit Foundation does. It's very, very unique in that respect. So thank you all for being here. This has been kind of an amazing event. I love to see all the support from the community and those who help make all this a reality.
A couple of things I want to say. As a fundraising executive, I will ask you for money tonight. But I just want to say, over the years being part of Patient Benefit Foundation and hearing the patients' stories, meeting the board members and the physicians that donate their time, it's just been so inspiring. But what I love about Patient Benefit Foundation, and the reason I've been with them for so long, is that we're not going to turn anybody away if you don't have a specific disease. We're going to help you regardless of what you need. And also the fact that I deal sometimes with people who have dire emergencies and do need that surgery right away. That's incredibly important for somebody. And when you talk about the psychological effects of, if you have a growth or if you have something that is in your way and it's really affecting your mental health, these elective surgeries, which are still very important surgeries, to have that done and to have that funded through Patient Benefit Foundation is extremely helpful. So I just want to thank everybody, and again, I'll ask you for money all night long. But if you want to know more about what we do, I'm happy to chat with you, and very happy to be a board member and part of the organization.
In our community, we have so many people who are suffering, who are in need of medical services, but just don't have the resources to pay for them. That's why it's important for us to have an organization like the Patient Benefit Foundation, who are able to step in and fund and provide those services for these people who are suffering.
People that don't have insurance and don't have any money, that the foundation can come in and help them pay for their surgeries, which can be quite expensive. So I think it's a great thing that Dr. Chaudhry is doing, and I am 100% supportive.
I've known Mubashir for about 15 years now, and he is a very, very passionate person. He loves to give back, and it really comes from his heart. He really does all this hard work to really benefit the community.
Well, the way the Patient Benefit Foundation benefits patients is through direct contact, direct services, and it fills the gap that a lot of patients find themselves in when they don't have insurance or there isn't coverage or funds. We're lucky that the Patient Benefit Foundation is there.